In a stunning shakeup at the nation's top public health agency, Dr. Susan Monarez has been fired as director of the U.S. Centers for Disease Control and Prevention just weeks after taking the role. Her abrupt dismissal has sent shockwaves through the public health community and sparked fears over increasing political interference in scientific institutions. Dr. Monarez was confirmed by the Senate in a close vote on July 29th and officially sworn in on July 31st, stepping into a leadership position already under intense pressure. The CDC has been grappling with sweeping staff reductions and major restructuring under the Administration for a Healthy America, a controversial reorganization led by Health and Human Services Secretary Robert F. Kennedy Jr. Over 700 CDC jobs have been cut this year alone, and numerous long-standing programs are being eliminated or drastically scaled back. The Biden administration confirmed Monarez's firing earlier this week, but her legal representatives insist she did not resign and has not received formal termination paperwork. The White House and Secretary Kennedy, however, maintain she no longer holds the position, and the agency has moved forward without her. The ousting appears to be rooted in philosophical and scientific disagreements between Monarez and Kennedy, particularly over vaccine policy. During her confirmation hearing and in early public statements, Monarez affirmed her strong support for vaccines, stating unequivocally that vaccines save lives and that there is no proven link between vaccines and autism, views that clash with Kennedy's long history of vaccine skepticism. Monarez also defended the benefits of fluoridated water, another stance at odds with Kennedy's previous public statements. Following her dismissal, several senior CDC officials resigned in protest, including Chief Medical Officer Deborah Oury and infectious disease expert Demetra Daskalakis. Internal messages from departing officials paint a dire picture. One stated, "If she leaves, we don't have scientific leadership anymore," while another warned that science will be compromised. The resignations underscore the deepening crisis inside the CDC, as many fear the agency's foundational principles are being undermined by political agendas. Under Kennedy's tenure at HHS, the CDC and other health agencies, such as the NIH and FDA, have faced steep budget cuts and personnel losses. Over 1,100 jobs were cut at the NIH alone. Key public health advisory committees have had their meetings canceled or suspended, and some vaccine policy discussions have been curtailed. Notably, a forecast warning of increased measles risk was shelved earlier this year, reportedly due to political sensitivities. Instead, the administration has shifted public messaging to focus on vaccine choice rather than emphasizing the proven public health benefits of vaccination. These developments come at a time when measles cases are rising and flu season looms. Critics argue the CDC's weakened capacity and silent scientific voices could leave the country unprepared for preventable disease outbreaks. Public trust in federal health guidance, already fragile following years of pandemic-related controversy, may now be further eroded. Dr. Monarez has not made a public statement since her removal, as the agency struggles to maintain its scientific integrity under mounting political pressure. Public health leaders are warning that decisions made now could have lasting and dangerous consequences for the nation's health.